Hey doc, I'm suffering with pain. What should I use? Ice or heat? Which one's going to be better? Stay tuned to this video and we'll discuss. Hi, my name is Dr. Brandon Pettke with Lone Star Progressive Medicine. On today's video, what we're going to discuss is whether I should use ice or heat when I have pain and I have an injury. It really depends, but my general rule of thumb is I'm going to lean towards ice. Okay, anytime we're dealing with pain, essentially if we look at it at a cellular level, we are actually dealing with inflammation. And so one of the main things that we want to do through various different treatments is bring down that inflammation. Ice is going to be one of those things that's going to bring down inflammation. If you have an acute injury, and so what I mean by that is something that's recently happened within the last handful of days or week or something like that, you should definitely use ice. That would be my go-to. I always encourage patients to use ice about 20 minutes once every hour, something like that, and just repeat as necessary. You want to drive down that inflammation as much as possible. Sometimes people use heat. I've even had patients that have gone to the ER and they said, just put a heating pad on it after an acute injury. I would not recommend that. You're already having problem in what's called the interstitial fluid, the small in between all the cells, with getting rid of waste products and inflammation. The last thing you want to do is bring more blood flow to the area and create more inflammation. So don't use a heating pad or a heat source or anything like that, especially in an acute injury. All right, you really want to stick with ice. So that's in more of an acute injury. A chronic issue, you can kind of go either way. So a chronic issue is I've had this pain for months or years and it's kind of flared up on me. What should I use? My general rule of thumb there is because there's a lot of people that will say a hot shower or get in the hot tub or heating patterns, things like that will help them. I say do that first and then afterwards come back with some ice. So we're bringing some blood flow to the area from the degenerated tissues, and then afterwards we're bringing on ice and we're driving out the inflammation. So that's what you would do more on chronic type situations and chronic injuries and pain syndromes. You'd want to use heat first and then ice. But if I didn't know any better, what I would do, I would use ice, use an ice pack 20 minutes once every hour, as often as you need to try to drive down that inflammation. That should help you with some pain. Anyway, hopefully this information was useful. As always, if you ever need anything from our office, you're more than welcome to contact us. We'd be more than happy to help you out. Our contact information will be at the end. Have a wonderful day.